And now, Yahala with Dr. Abu Shanab, brought to you by Bridgeview Chiropractic.
Yahala with Dr. Rashid Abu Shanab is a weekly show hosted by Yulia Rihani and myself. My name is Dr. Rashid Abu Shanab. I am a chiropractic physician, and we thank you very much for tuning in today. This show is sponsored by my chiropractic clinics in both locations, the Bridgeview Chiropractic off 83rd and Harlem, and the Romeoville Chiropractic. We do treat lower back pain, neck pains, and injuries related to auto and work-related injuries. Today we are hosting Dr. Rafia Salim, an MD. Dr. Rafia Salim, welcome to our show, and thank you so much for coming.
Thank you for having me over. It's a pleasure being here.
Thank you. Dr. Rafia Salim is a licensed Illinois physician. She is a board-certified radiologist by the American Board of Radiology. She is a fellowship trained in magnetic resonance imaging, which is the MRI. She is the director of Western Open MRI since 1998. Western Open MRI, located at 6728 Cermak Road, intersection off of Cermak and Oak Park. In Berwyn, the phone number is 708-788-8900. MRI, doctor, is such a great diagnostic imaging tool. I use it a lot myself. We refer some patients to help me further diagnose and proper perform a treatment methods and treatment plans with patients. So, Dr. Salim, I would like to please tell our listeners about what's the different types of the MRI. As you know, some patients come in, they wanted a closed MRIs. Some others, they are in open MRI, and some MRIs in trailers. So what is the difference between all of that?
Okay, first of all, I would like to explain what is an MRI. MRI is magnetic resonance imaging. It's a modality that does not have radiation. It's very safe.
Oh, wow. Okay.
And it could be performed in young children and in even pregnant females after their first trimester. And there are several types of MRs, closed and open, and they come in different strengths. And the strength of an MRI machine is measured in Tesla units.
Okay.
And they could be anywhere from 0.3 to 3 Tesla. And most commonly used, most efficient for routine work would be a 1.5 Tesla machine. And the higher field strength machines are used mostly for research, for brain functional studies, for abdominal work.
Okay.
And the closed MRI is a long tunnel, usually about 4 to 5 feet in length, and the diameter is anywhere from 37 to 45 cm. And the closed MRIs are quite noisy, and people who are claustrophobic, they really cannot take it.
Yes. But is this closed MRI, is it like better images versus the open? Or is it like very close, like the open one is okay as well?
If the strength of the magnet is similar, open and closed MRI would have equivalent image quality.
Okay. A lot of patients actually, they bring in sometimes their CDs to our office, and the image quality, it does matter, especially if the patient's a little bit overweight or anything of that nature. So you mentioned a little bit about the strength of the Tesla. Is the newer machines now a little bit better and higher efficiency versus the previous ones before?
For open magnets,
Yes.
a 1.5 Tesla is a relatively new, I would say approximately 2 to 3 years. Before that, the highest strength they came in was 1 Tesla unit.
Oh.
But with the high field magnets open, especially for people who are obese or big, fat, or claustrophobic, this is a great blessing.
That's great. Now, as far as ordering an MRI, we have like the contrast part where the patients, when they go in, Dr. Rafia, when they come in to do the MRI, we sometimes order with contrast, especially patients who got lower back surgeries, or if we're doing a brain. So sometimes we do that contrast order, and sometimes we don't. And sometimes we have to order a CT scan and an ultrasound. So if we divide this up, like what should we go with the most? Should we go with, like, let's go with the spinal conditions. For example, if it's a person coming in after a car accident and they have a spinal injury in the necks and the lower backs, what do you recommend is the study of choice? Is it an MRI? Is it a CT scan? Or whether should we use an injection or not with the patient to use a contrast?
Okay, number one, it depends on the patient. If there's no contraindication for MRI, the number one contraindication is patients with pacemakers, heart pacemaker, and people who have had surgery for aneurysm of the brain.
Okay.
Even with aneurysm now, they have newer clips that are more compatible with MRI. So my first choice would be for anyone who is involved in an automobile accident to get first usually is an X-ray,
Yes.
which is done in the emergency room, and then an MRI.
Okay.
MRI is very useful. It can give you information about the vertebral bodies, their alignment, if there's a fracture, if there's any cord injury, or if there's a herniated disc.
Correct. So as far as the MRIs, this is the one I always actually, over 99% of the time, we order an MRI. But how about the CT scan and the ultrasound? I mean, when the doctors actually order this?
An ultrasound really doesn't have much utility in trauma cases.
Okay.
For CT, as I mentioned to you, unless they have a contraindication of MRI, then go to CT. That's the second choice.
Okay. So if somebody with a pacemaker, are they okay with the CT scan versus the MRI?
Definitely.
Okay.
They can have a CT scan.
Okay. And then the other part, if, we keep talking about the patients with auto injuries. This is the ones we usually see. But people who develop, let's say, concussion or dizziness part, or they actually nauseated, we have sometimes ordered the MRA, which is like an artery study. What is the MRA per se? A little bit more detail.
Okay,
Doctor.
the difference between MRI and MRA is MRI is a brain study, and MRA, it concentrates on the arteries of the brain. And for someone who was involved in an auto accident, the number one thing would be to get an MRI, and contrast is not necessary because the information we are looking for is bone concussion or hemorrhage.
Oh.
So for those two conditions, a non-contrast MRI is accurate 99.9% of the time.
Yes. Now, patients coming in, back pain or neck pain, going down to the arm or shooting down to the legs or both legs, secondary to a car accident or work-related injuries. You indicated the most common symptom. The most common thing that you might see on an MRI. It's a disc herniation. And, many patients come in and say, oh, yeah, I have a herniated disc. But when you look at the actual report and you look at the actual CD with the MRI, it's a little bit of a bulge versus a herniation. So can we just explain a little bit the difference between a bulging disc and a herniated disc, for injuries related to car accident?
Okay. A bulging disc is when there's diffuse bulging. That means it's entire circumference of the disc is involved, and a herniation is a focal protrusion.
Okay.
So that's called a herniation. And again, herniation would be two types of herniation, a protrusion versus an extrusion. So
Yes.
most doctors would know the difference.
See, the extrusion is like the one that's more severe, of course.
In an extrusion, the herniated disc has a small neck that's connecting to the main disc.
Okay.
And a protrusion is a broad-based bulge.
So the herniation per se, it's a little bit more severe versus the bulging. Bulging, it's a little bit of a less
Bulging is really not as important
as a herniation
as
per
a
se.
herniation.
All right, then we're just gonna go a little bit and refocus on what is the patients with cancer. We talked a little bit about patients who have a pacemaker, patients who have an aneurysm in the brain or something. But how about patients with cancers? The MRI will be the method, or should we look at a CT or an ultrasound? I mean, what do you have mostly that you see common?
Okay, it depends where the cancer is. If we are looking for a primary cancer in the brain, MRI is the gold standard, and it should be done with and without intravenous contrast.
Okay.
And even if it's a distant cancer, like somewhere in the lungs or kidneys, and these cancers do tend to metastasize or form secondary deposits in the brain. Even for those conditions, we do need contrast.
Okay. But if it's a spinal issue and a patient coming in with a back pain, and we did an MRI, the cancer can also show that, right? Even for not painful condition. Like let's say a patient come in and we ordered an MRI for the lower back and the x-ray did not show such a thing. Could the MRI detect that without the history that we give?
Oh, definitely.
Yes.
If there is a cancer or a neoplasm, we can see it.
Absolutely. Western Open MRI located at 6728 Cermak Road off of Cermak and Oak Park. The phone number is 708-788-8900. For a consultation, please contact us directly, contact our office directly. I'll be more than happy to discuss your case and order a specific MRI or a CT or an ultrasound accordingly. Our phone number here at the office in Bridgeview, 866-599-BACK, 866-599-BACK, which is 2225. Dr. Salim, does insurance cover the MRI in general, or is there any issues with that?
Okay, most insurances do cover MRI, including Medicare, but some insurance companies require pre-authorization. They have to authorize, and sometimes they may not allow contrast injection, but sometimes the doctor's office will have to call and convince them the indication, and they would do it.
Like with the medical necessity letters or anything
Correct.
of that nature?
Right.
Okay. But your office will be able to help our patients out if such a question develop?
Yes, our office staff is really trained, and they can talk to the insurance company and get the pre-authorization.
Great. Dr. Rafia, many patients, ask me, Dr. Shanab, please, I need a full body MRI. I want everything to be tested. So I of course, I'm just like, well, this is a little bit hard, but is it possible? I mean, can we order a full spine MRI? I mean, that's a little bit too long, no?
Yes, it could be done, but it's definitely not necessary. MRI is always best when it's done as a targeted study. You have to attack the problem, and there are several options available depending on what the patient is suffering from. So a total body MRI is not a very good idea.
Yes. So what do you recommend for, stuff like that? If somebody who was like, well, I want my full body to be imaged. I mean, what can you order for something like that?
Okay, for spine,
Yes.
I would go for MRI. But if somebody is having abdominal pain, my first choice would be to get an ultrasound. The most common offender in the abdomen is the gallbladder.
Yes.
If that is normal, still has pain, then I'll go to a CT scan, and a CT scan can be done with contrast or without contrast. If you're looking for a kidney stone, just do a non-contrast CT.
Yes.
But for everything else, we have to give them something to drink, and then they'll get an injection also. And it's a very comprehensive exam.
For our listeners, I understand this dialogue, it's quick, but if you have any questions, please give us a call. We'll be more than happy to answer any of your questions. Our phone number here at the Bridgeview and Romaville Chiropractic is 866-599-BACK, or the Western Open MRI at 788-8900. Dr. Salim, now we talked about a little bit about patients who are having a pacemaker or an aneurysm. Those are the patients that we cannot do the MRI for them because of some of the side effects of that. But how about patients who developed or have a knee ACL repair or a lumbar spine, or lower back in general, screws? Are those okay to be able to do an MRI?
Okay, patients with screws in the lumbar spine, yes, we can do it. Because patients who have had surgery, sometimes the spine segment that's above it could develop a recurrent herniated disc.
Yes.
So for that, definitely we can do it. And number 2, for ACL repairs, yes, it has lots of information. If the graft is broken or ruptured,
Yes.
we can diagnose it. But someone like a hip prosthesis or a total knee replacement, the exam is not very useful.
Okay. But definitely questions like that, we can call you directly and you can help us out a little bit with that, because sometimes yes, sometimes not. So it's become a little bit confusing, but I'm glad that being a great radiologist here in the Chicago area, Dr. Rafia Salim, and with all your experience, besides the MRI, I think the radiologist who reads the MRI is actually the more important. Some doctors refer their patients to, next to the office location or next to the house location, just to be convenient. But in my experience, actually, with my patients and others, we really need to be sure who reads the MRI. The radiologist is really important. I mean, you have a great picture, but if you cannot write down everything that you see, that's really crucial. Would you agree with me on that?
Yes, I certainly agree. It depends very much, the benefit, how much you get from the MRI. It depends on the skill of the radiologist, the experience, and the training. So definitely it would make a difference who is interpreting the MRI.
Absolutely. And this is the thing that we see very common with some X-ray reports come in from the hospital or some other doctor's offices where they say there's no fracture. Well, yes, they are absolutely correct. There is no fracture per se, but there's other things. If the hip is out, if the bone is misaligned, if one leg higher than the other, if there was a previous fracture or a previous churning, if there is any kind of curvature in the spine, a lot of radiologists don't think this is related to the patient's condition or the patient's presentation at the time. So the radiologist by far, really needs to be sure that they write everything they see. And I see this a lot in your reports, Dr. Rafia Salim, and I admire you with that. And thank you very much for doing this. Now, Western Open MRI located at 6728 Cermak Road off of Cermak and Oak Park at 708-788-8900. For our consultation, please contact Western Open MRI directly or call our office at 866-599-2225. This show is sponsored by Bridgeview Chiropractic and Dr. Rashid Abu Shanab at www.drshanab.com. Dr. Salim, I would like to see if you please can share with us any case that it's a remarkable case for you that you still remember. You've been, God bless, 17, 18 years in practice and God knows how many years in college. We will not going to discuss that, because every time I say stuff like that, this is when the gray hairs start to come out. So do you remember any case, through your residency or through your private practice in the hospitals, about specific case that you'd like to treat with us or share with us?
I remember 2 cases that happened in our facility. There was a young woman. The doctor sent her to me for back pain and MRI.
Okay.
We did an MRI, and her back was fine, but I noticed on the very first film that we use as a localizer that her kidney didn't look right. So I called the doctor. I told her we need a CT scan of the abdomen. And lo and behold, that patient had a 7 cm cancer in her kidney.
Wow.
So this is where the experience and the expertise of a radiologist comes in.
Yes, yes. And of course, with the kidney issue, it's very common to cause a back pain.
Right.
How-
And the thing is, if we did not pick it up, she would have been dead in 6 months.
Oh, wow.
Because kidney cancers are very vascular. They spread fast to the lungs and brain. And she's still alive and well after 5 years.
How old is she at the time?
She was in her late 30s.
Oh, wow, she's still young.
You
And,
know?
something like that you don't, expect.
I never forget that, you know.
And you
So
said you
there
have
was-
another case too?
There was another case. We did a cervical spine, totally unrelated. But when we do the cervical spine, we try to include the lower part of your skull. And the cellular turcica was enlarged, and she had a 2 cm mass in the pituitary gland.
Wow.
Totally incidental finding.
Yes.
So these two came to my mind. There was another patient. The doctor sent the patient for a CT scan of the kidneys, rule out kidney stone. But I noticed the patient was walking funny. So he was a young patient, about 30 some years old. I did the CT, no kidney stone, but I didn't like the way his spine looked.
Okay.
So I called the doctor. We did an MRI. You wouldn't believe, Dr. Shanab, the whole marrow in his lumbar spine was replaced by cancer cells.
Wow. Wow.
So I think a radiologist's experience
Absolutely.
and the experience and the efficiency definitely plays a big part in the patient care.
Absolutely. And that's why I'm glad that we have a little bit left to go. If we go through some of the body parts, like let's go with the head just to summarize to our listeners what we have. Like, let's say patients come in with a headache, dizziness, or some arm numbness and tingling, car accident, concussion. What do you recommend for that? An MRI or a CT?
For that, if it's related to trauma, if you're looking for hemorrhage or a fracture, do a CT. But aside from that, when these symptoms occur, dizziness or tingling and so on, an MRI would be the best choice.
Okay. Now, if we're talking about, you mentioned earlier about cervical spine, mid-back, lower back pain, is that an MRI or a CT?
Definitely MRI, unless it's contraindicated.
Okay. So if there is a pacemaker or somebody who's
aneurysm.
afraid or aneurysm, definitely. But as we said, if you have a surgery in the back, surgery in the legs, the MRI is still okay.
Correct.
Now, if we're talking about the arms and legs, we're talking about the x-rays are the main thing for fractures. But if there is an acute injury or, something just developed now or acute fracture, is that an MRI or CT scan or bone scan or something else?
Okay, if a patient comes in with pain in the leg or hip or knee joint, if the x-rays are negative, then an MRI would be the second step to do. There are so many times when I can see a stress fracture, like in
Yes.
runners. X-ray would not pick it up, but we can pick up a stress fracture, especially in runners and people who have minor bone contusions.
Okay.
An X-ray cannot pick up that information.
How about some OB and like uterus and areas in that nature? Is that part of the ultrasound per se more than an MRI, or we can say
Mostly ultrasound
ultrasound?
for OB.
And the sinuses?
For sinuses, a CT scan would be fine.
Okay. And chest? Anything with the lungs?
I think CT is still the gold standard. It's simple, fast to do, but for problem solving, we can do an MRI. But for routine problems, a CT is definitely the gold standard.
Well, Dr. Rafia Salim, I thank you so much on behalf of Yahala Voice and YahalaVoice.com and the apps and the 1450 AM. We thank you so very much for coming and spending your day today with us. Western Open MRI located at 6728 Cermak Road off of Cermak and Oak Park. The phone number is 708-788-8900. For consultation, please call our office directly at 866-599-BACK, or you can call the Western Open MRI at 708-788-8900. This show is sponsored by Bridgeview and Romiville Chiropractic Centers, Dr. Rashid Abu Shanab, www.drshanab.com. From Yahala Voice, this is Dr. Rashid Abu Shanab. This is Khaled Khilfe, our producer, and on behalf of Yulia Rihani, we thank you very much for tuning in, and thanks to our listeners, and thank you very much.